Hey guys, welcome to Diamond Words Podcast. And this is a slightly different show in that I was on vacation a few days ago and I came across a trending video on a relevant topic on fillers. And it's called The Scary Truth About Fillers. Now, the purpose of this show today is a rebuttal to some of the misinformation and disinformation, but also a celebration for the individual hosting the podcast show on The Scary Truth About Fillers, a celebration on her courage to talk about fillers, what she likes, what she doesn't like, and to bring some of these topics to the table. So here we go. Now again, this is The Scary Truth About Fillers. I see here the comment section with Brett Cooper. In any event, I will listen to this video in its entirety while I respond to you.
There was something that I did not know about this hyaluronic filler, and maybe this was common sense for some people, but I just completely believed what the doctors were saying, and even though there were things that I didn't trust about it and didn't like about it, I did not know this specific fact.
First of all, she starts by saying she completely believes what the doctors were saying in reference to fillers and then being able to be dissolved or that it goes away. The truth is we all need to believe that our medical providers are giving us information that is truth, but also information that is relevant and information that ultimately can steer us into a decision, positive or not. But you should never blatantly just believe another medical professional, or should I say another human being, without doing your research. So anything that's negative that comes out of your doctor's practice, some of that risk is on you. You must do your research. Do your due diligence. Don't just trust a medical professional because that person has been treating you or your family for the past 20 years.
I did not know this specific fact, that it actually never goes away.
That filler never ever goes away. Well, the truth is most of it does go away. It becomes degraded by the body. However, remnants of the fillers can remain where they were injected. And when that happens, yes, you can pick it up on the MRI. It doesn't mean that the entire syringe is floating in your face somewhere. It just means that most of that filler has been dissipated or degraded and eliminated by the body. But however, the body will sequester or trap some of the foreign body within the face at times in different patients. So this is not a terrible thing to discover.
So women online who are trying to be more natural will talk about going in to get their fillers dissolved, and it's also a common understanding that you usually wait until your filler naturally dissolves to go in and get more syringes of it, whether you're getting it in your cheeks, your jaw, your nose, your under your eyes, whatever you're doing.
Women were going in to be more natural by getting some of the fillers dissolved. Well, this is a problem for those women who were over-injecting to a point that they had to remove filler. Because if it's done well and if it's done right, there's no reason that you would have to dissolve it. You would look natural if the filler was done right. So it's not an argument against filler. This is an argument against the providers that overfill these women's faces that force them to go in to remove the filler.
MRIs that are now going viral on social media show that this filler actually never goes away.
Yes, filler can migrate. For example, when you place filler in the nasolabial folds, sometimes the filler can go up into the cheeks. When you place filler in the lips, it can ride up into the upper ergotride or the upper tissue above the lip. The problem with that is not the filler. Again, over and over and over again. The problem with that is the injector choosing the wrong type of filler for that area. If you inject the right product in the right place, using a technique that keeps your filler in the lips, it will not migrate to other areas. This is an argument for the practitioner choosing the right filler and the right technique for the area in the face being injected. It is not an argument that filler just injected in the face will migrate. Anything can happen in life, anything can happen. But if filler is migrating and moving around the face, then we have to question which filler is more likely to migrate and move under normal stress conditions of the face, such as pressure within the face, sleeping on the face, pushing, moving around the face, using gouache or other non-medical methods to rejuvenate the face, facial exercises, facial massaging, facial yoga. These are things that can potentially move the filler. And this is why I speak heavily on using the right filler to avoid excessive or even to avoid migration of the filler. It's not an argument that filler just migrates. The argument is that many practitioners are using the wrong filler in areas of the face that tends to allow migration to occur.
So the video that started this conversation on TikTok was from a doctor who took one of these MRIs and decided to talk people through it. And they were absolutely floored. Just watch.
What you're looking at here is an MRI image of a 33-year-old patient who had over 12 cc.
So there's a video being played, Kami Parsa MD, on MRI image of the face showing fillers placed in the face, and the claim was that the patient said that she had 6 cc's of fillers in the face over a short period of time. I think it might have been 2 years. However, using MRI scan, it shows a volume of approximately 28 cc's. The fact that the volume is more than the actual cc's is normal. The problem is that too much filler was either placed in any particular area, the technique wasn't done good enough to maintain the location of the filler in the face. Again, this is not an argument that filler is bad and it shouldn't be injected. This is an argument that the practitioner that's doing the procedure doesn't have enough training or understanding to know exactly which filler to use where and what technique to use.
She has 28 syringes of filler in her face because it never actually dissolves.
And what this shows us is that hyaluronic acid fillers are hydrophilic.
Imagine that, like cottage cheese, just like sitting under your skin. Oh my God.
So yes, hyaluronic acid is a hydrophilic product. It binds to water and it inflates, it grows. That's what makes us look so good when it's done well. But to use the reference that it's like cottage cheese and oh my God, it's under the face and the skin, I think this is looking for bites. I think this is looking for followers, and I think it's looking to trigger people to kind of subscribe to this individual. It's kind of baiting, and it's also shaming. So you have a young individual, I don't have her name, but you have a young individual, you know, obviously with makeup and camera and lights, looking all perfect in the camera, shaming older women on them having to or wanting to use fillers. My argument on this video is almost as though she's attacking fillers, the industry, the practitioners, but also attacking other women for having chosen to do some fillers. Because not every woman does 6 cc's of fillers in the face over the course of 6 years. Not every woman or male does multiple cc's in any 1 year. Many of my patients do 1 cc a year. Some may do 2. So I think we're going into shaming individuals for taking care of themselves to reduce the severity of lines or wrinkles. So we are shaming people who are aging based upon the video that I am listening to, and maybe this is why it's triggering me.
Oh my God.
That means they love water, and they also cause tissue expansion.
So, for many women, like me, they had no idea. Like, I knew that there were consequences of filler. I knew that it was not natural, that it was not good for you. I had no idea that it actually never went away. Somebody commented and said, when it first came out, all injectors said that it would only last 6 months. And the guy responded and said, that's what the filler companies were telling us. That is what they were telling doctors. I mean, like, what is it with the medical industry that somehow is apparently just, exempt from all regulations, exempt from actually being honest?
Well, the medical industry is not exempt. There's certain things that the medical industry have to do. However, I do agree the medical industry have let down the population of individuals that they are catering to. If you look at medications such as Ozempic is being prescribed by any doctor who feels that they want to make a little bit more on this product by reducing weight in some of the patients who are asking about it. I don't believe Ozempic is the best medication for weight loss. I think healthy eating and exercise, getting your butt off of the couch, doing a proper workout, investing the money on a personal trainer or on equipment that keeps your body moving, that keeps you in shape, is a much better choice than using Ozempic, which creates approximately 30% muscle loss. Muscle is required for some hormonal regulation. So when you remove that muscle, you are hurting yourself. So yes, the medical industry have consistently let us down. And so I applaud her for bringing this to light as another example of big pharma not giving enough information out there because it may hurt their bottom line. Yes, we are all guilty of it. Everyone is guilty of something at some point. What must occur is that we self-regulate ourselves as well. We don't just listen to the medical provider and do what he or she says. We have to do the work. We have to research. Google is an excellent place for patients to go and get some information. The problem there is it's too much information. However, if you look at the source of the information, then you're able to disseminate helpful information and not just looking at websites from medical practitioners who have something to sell you.
And all throughout the comment section, women were saying, well, my esthetician is still telling me that I need to come in every 6 months because it's dissolving. Like, what is happening? Are they lying to me? What's going on?
There's a comment about an individual who stated that their esthetician told them they should come in every 6 months to get refills of the fillers. Here's the problem again. It's not that the filler is bad. It's the esthetician that, number one, should not be advising patients on fillers, should not be administering fillers, and should not be marketing fillers in a way to sell to patients, because an esthetician is not qualified and does not have the medical training to perform medical procedures such as fillers. So the number one problem goes back. The root of the problem here is not the filler itself. Filler is just a device. It's a drug. It's like a mesh in the abdomen after abdominal surgery, or it's like an implant in the heart, or it's like hardware on the bones after surgical manipulation or repair of broken bones. It's just a device. How we use a device is on us and the practitioner. The problem is not the device. The problem is not the tool. The problem is the person wielding that tool.
And slowly, women started to realize that this information actually had been out there. It just hadn't been communicated to them by their own doctors. And this girl sums up my feelings very well.
Maybe this is naive, but I was kind of under the impression that after that doctor showed the 3D scans of all the filler in people's faces over time, that maybe the entire filling industry would be paused to a halt until they figured out what to do about the fact that the filler doesn't leave these people's faces.
The entire industry will not be halted because fillers last much longer in the face. Again, fillers are safe. we don't have any medical studies that shows us or tells us that hyaluronic acid is detrimental to the body. Unlike many things we put in our bodies from the grocery store that contributes to cancer. Unlike sunblock that's put on the skin and can contribute to cancer also. There's so many things out there that kills us. Filler is not one of them. Botox is not one of them. Sometimes I feel that we direct our anger to the thing that we can beat up, which is the vanity in individuals, but vanity is necessary and vanity is in everyone. The mere fact that the host of this show that we're looking at has a very beautiful face, but she has makeup, her hair is done, she's very stylish, she has her jewelry. That's a degree of vanity. So how can we tell someone how vain to be? You know, you can't take care of yourself, but tell someone else, well, don't take care of yourself that much. You know, now we're policing individuals and how they should look and how should they take care of themselves. If someone doesn't want to do fillers or doesn't like fillers, then they should not. But they cannot tell someone else not to do fillers. Again, the filler is not the problem. It's the person wielding the filler or the person allowing too much filler into their faces.
I mean, girl, there were literally people dying suddenly, coincidentally, right after they took an experimental vaccine, and they did not stop telling us that we needed to inject that into our bodies.
I feel it's disingenuous to use the word vaccine since it's a huge trigger in the same sentence or paragraph as fillers or Botox. It is unfair to the beauty industry. It is unfair to everyone who has had fillers and Botox to put vaccines and fillers in the same sentence.
But I mean, what do we even really know about that? Like, can the filler even be dissolved by a doctor? It might not dissolve naturally, but can they pull it out? Like, we have so many questions now. The only thing that I've seen online that might be effective is people use those like gua sha things and they'll massage their filler back into place. It's the weirdest videos.
The comments here is about the movement of the filler in the face and not having the ability to dissolve the fillers. Number one, fillers definitely can be dissolved. The disulfide bonds, fillers can be dissolved. The bonds of the hyaluronic acid can be broken down so that the body removes that filler naturally. Remember, hyaluronic acid is a natural product in our bodies. Our bodies eliminate and remove hyaluronic acid every day. From the time you're born to the time you're dead, hyaluronic acid is in your body. The farm industry have found a way to harness hyaluronic acid, conjugate it so that it lasts longer and reimplant it into the body. So yes, it can be dissolved. That is nothing that we have to figure out. We already know it can be dissolved. I have dissolved many fillers in patients who came to me crying after having injected by someone else. So it can be dissolved. The next point that's being made here is, well, you have to move the filler around to keep it in place. If someone ever have to move filler themselves in the bathrooms to keep the filler in the lips or in the cheeks, then there's something wrong. Probably with that individual, but also with the technique and the medical provider choosing the wrong product for that patient's face. That is not normal. My problem with this video is, I get it, you know, we make money from everything. Maybe or maybe not she's making money from the sponsors of her show or trying to get enough followers to attract sponsors. Everyone is making money somewhere. It is disingenuous to berate a company, but you yourself are making money from sponsors and associates of those companies. If you follow the money trail, you will always find someone is making money somewhere. The problem is not the filler again. The problem is who's doing the filler. If you have to push filler back in place, maybe you're going to the wrong person. Maybe you didn't do enough research to figure out how much experience this individual have or whether they're licensed. We cannot put all of the blame on the medical industry. We have to take account for some of the decisions and choices we make also. If you go to your dentist and something crazy happens and you found out that he hasn't been licensed for 20 years, that's also on you because you didn't do your due diligence. But yes, that dentist is also in the wrong, but you are not without blame also. In the medical industry, there's blame to go all around. When I speak to my patients, I spend tons of time with my patients speaking of everything about these fillers. Am I going to miss some things sometimes? Of course, but at the end of the day, I make sure that my patients are safe, they look very natural, and they're happy to come and see me.
It's like women and they have lip filler and it's moved all the way up to their nose and they like put their fingers up their lip and
441. If fillers are moving from the lips up to the nose, above the lips, on the cheeks, it was the wrong filler. If your filler is moving in your face, it is the wrong filler. Go back to the individual, to the medical practitioner who injected you, and tell them that they used the wrong filler on you. There's something called rheology, and rheology is the science of fillers. Rheology tells us mathematically what happens under general stresses to the fillers. So within the face, there's natural pressures in the face. There's shearing forces, there's compression forces, there's dynamic movement, there's pressure from internal swelling after the procedure. All of these can affect the filler. Rheology tells us which filler is likely to stay in place and which filler is likely to move or separate and go other areas in the face. I call it the breakability of fillers. And the breakability is the likelihood that this filler breaks apart and goes somewhere else. And therefore, in my practice, I never use fillers with a high breakability, the ability to break apart and move and go somewhere else. So if your filler is moving in your face, as what is being said by the host here, then you're going to the wrong person, or that individual is using the wrong filler on you.
somebody commented and said, I went to a plastic surgeon for filler and he refused. I was so mad, but now I am so thankful. You know, like good doctors will actually tell you the truth and will advocate for you based on your personal experiences and your body and your health, even if it means they will not make money off of you.
Good doctors will give you good advice and advocate for you, blah, blah. Yes, good doctors. In life, in any medical, in any profession, there's the good and there's the bad. That is the same with medicine. There are practitioners that will milk you dry, take all of your money and give you very little to show for it. There are others that would turn you away because it's not the right procedure for you. The reason I left standard medicine, such as orthopedics, neurology, physiatry, internal medicine, primary care, I've done so many specialties. The reason I left standard medicine to come into aesthetic medicine was because I didn't want to be forced to guide patients into a place that I didn't feel was right for them. And therefore I left the energy. I took more than a 50% pay cut to get into aesthetic medicine at a time where people didn't know what Botox was. You weren't making money off of it, and this was 2003, 2004. And I rode that industry, and today I still give as much helpful information to my patients. I still refuse patients' treatments if it's not necessary, but not every practitioner is going to be me or like that. Due diligence is still necessary on the patient's part. But in life, we have to understand that you cannot blindly trust a medical provider, a dentist, a lawyer, a carpenter, your plumber. You can't blindly trust professionals, unfortunately.
Somebody else said, it genuinely snapped me out of some of my body image issues when I learned about how little long term research there is in simple routine cosmetic procedures. Like, I'm good actually. Yes.
There is a lot of studies on, for example, Botox. We know what Botox is, we know where it came from, we know what it does to the body. We don't know everything about Botox, but we know that it's generally safe. If you compare the safety of Botox to, let's say, Tylenol, Tylenol is responsible, I think it's either the second or the first leading cause of kidney transplants. Tylenol. Now, there are other medications that allow a certain number of deaths per year to still be considered safe. Botox does not have deaths per year unless in special circumstances. So generally, you have millions upon millions of people doing Botox. No one dies from it. And if someone dies, it's typically because of the negligence of the medical practitioner or non-medical practitioner applying that Botox in a way that they shouldn't, or from a supplier that they shouldn't be getting that Botox from. Remember, there's fake Botox on the market. Many patients look for the cheaper deal. So they go to the places that may have the Botox $100 less. You know, Miami is, I think everyone knows, Miami is like one of the cheapest meccas for Botox. You don't know where that Botox came from. Quick story and a true story, I was on a plane from Fort Lauderdale to New York, and sitting next to me was some type of sales rep guy and his daughter on the outer lane seat next to him, and she was a pharmacist. And we had this discussion based upon me being in medical aesthetics. You know, we spoke about fillers and Botox, and then the conversation went into a direction where he was telling me that he brings in Botox and fillers from his country, Russia, and sells to doctors at great deals. And this is the problem. If you're getting cheap Botox or cheap fillers, you don't know where that Botox is coming from. You don't know the facility that made that Botox, how clean, how hygienic, or how safe the facility that made that Botox. So I'm using the word Botox for the industry of muscle relaxers or muscle paralyzers that reduces the signs of visual aging in the face, such as lines, creases, and wrinkles. I'm using the term Botox for that entire category. This could include Dysport, Xeomin, Jeuveau, or Daxxify. Botox in itself is very safe if it's purchased from a reputable company and administered by someone who's licensed to administer medical products or medical devices.
There's so many other alternatives. There's so many natural alternatives than shoving filler up your face. Like, you should just be taking collagen to start with, which you can get from good grass-fed beef at Good Ranchers.
So here we have one of her sponsors, which is Good Ranchers something meat something. Exclusive offers for my viewers. Again, now you can see what I said previously. If you follow the money, you find the individuals that are using the influential powers in social media to make money. And this is one of those cases where it's fine to have a sponsor and to push beef if you're going to make money off of the company, but to try to shame individuals from looking their best using non-surgical medical devices and drugs, I think that's wrong. But hey, this is a free country of speech. You can say whatever you want to say. Everyone is allowed to. So I applaud her for speaking up and starting this conversation. However, you know, the hypocrisy is there. It's right in your face. But that's fine because we all need to make money. So let's not attack her. But let's just understand that medical procedures, surgical procedures, and dental procedures have risk. We all know that. The level of risk may or may not be given to you in its entirety by the practitioner. Here's one reason why. When you sign your consents to have your medical procedure done, many times it's 10 plus pages. Imagine having a consultation and the medical provider has to read 10 pages of information to you and ask you if you understand. It's impossible. So as medical providers, what we typically do, we try to give the most important information verbally. However, the written information in its entirety is always available. And at this point, most of us know the safety of Botox and fillers. But to shame people, to shame the aging group by a young individual with makeup, smooth face, zero wrinkles, being sponsored by a beef company to promote collagen growth, I think is a bit disingenuous. I still applaud her for bringing this topic to the table, and I have no criticism on her personally whatsoever.
It is still wild to me that in like 5 years, getting filler went from being considered plastic surgery to being like getting your nails done. Yeah, like now it's on TikTok of like, come get filler with me, come get injected for the 4th time this year. It is wild.
Here, I do agree with her point. The medical industry has allowed Botox and fillers to be done by just anyone with a medical license. And I don't criticize a practitioner for doing Botox or fillers to make extra money. What I do criticize is the lack of training they have to administer something like fillers that is life-changing. When I was in orthopedics, I can fix your bones. I can remove your painful shoulder. I can fix your damaged knee or your painful back. Great, patients were appreciative. But when I moved into aesthetic medicine, the appreciation of me skyrocketed from my patients because I gave them something back. Something that the host here isn't going to understand because she's super young. Maybe she's 23, maybe she's 28, 30, she looks very young. She cannot appreciate someone at 40, 50, 60, or even 35 who says, I want to soften my lines and look more youthful. She cannot appreciate that. That is huge. The amount of confidence you get from looking your best is immense. The damage from medical providers choosing the wrong product, not having the training to use the right technique, does you, the patient, a disservice, and it creates harm for the patient. So we all have the oath when we graduate, do no harm. And this is in my book, written last year, 2023, November, published. You can get on Amazon. Do no harm. My question is, when we take that oath, what harm do we mean? Do we mean financial harm? Do we mean do no physical harm? Do no medical harm? Do no psychological harm? Do no financial harm? What harm are we talking about? For me, I believe that we should do zero harm across the spectrum. And if every physician adopts that ideology, maybe the farm industry would re-regulate itself to offer nothing but the best and most and safest medications, drugs, and devices that we can use.
And then to loop this into another episode that we did, that is why I really don't feel bad for Kylie Jenner when she was sitting on the Kardashian show and crying about people making comments about her face. Like, girl, you drove an entire generation of young women to also do this to your face. You and your sisters created the standard.
Discussion about one of the Jenners crying on the couch about insults thrown at her for fillers in the face. I agree with the host. Here I have no issues. I have no bone to pick on this topic with her. We as an industry, we as a peoples need to follow and need to believe in. When we're older, 40, 50, 60 plus, we want to believe in the politician that's going to do the best by us. When we're 13, 16, we want to believe in the next celebrity, musician, or actor, actress out there. So we always want to believe in something or someone. Unfortunately, we're constantly being let down by the individuals that we look up to. How many times have you looked up to a statue of or a bust of someone from history, and to later find out that they were responsible for so much death and suffering? So we need to look up to individuals, but we're constantly let down. And therefore, if you adopt my ideology, don't look up to anyone. Find out what you feel is good for you, the environment, the people around you, and try to follow that course. But don't depend upon someone to guide you, to say, do what I'm doing. Because there's no human being on this earth that is so genuinely to help you. It just doesn't occur. Including Mother Teresa, who died a millionaire, I believe. Did she die a millionaire? I think she did.
You and your sisters.
Leave that in, Darren.
You lied about your cosmetic procedures, made everybody else feel terrible about themselves. They did this, they now regret it, they're angry at you, now you regret it, and you're not taking any accountability. Like, this is just such a crap show. Now, speaking of...
Yes, we need accountability within the medical industry. We need accountability within the aesthetic medical industry. When something occurs and the patient doesn't have a good result, practitioners need to blame themselves. If your practitioner never blames themselves for your poor result, go to a different practitioner. If enough individuals do that, then the poor practitioners, the practitioners that are doing the bad jobs, will be out of business. Or they will stick to the specialty that they're supposedly graduated for. Accountability is necessary on the part of the medical provider, which means that we have to blame ourselves. If I administer a treatment and my patient doesn't like the outcome, I have to figure out why didn't my patient like that outcome and do better. And from 2010, I've changed my techniques, I've trademarked my techniques, I've taught my techniques because I took accountability and found the right techniques for patients who are deserving of that technique, which is every patient. The name of that technique is Diamond Touch Techniques.
Another big topic of conversation under this umbrella has been pillow face. And if you don't know what that is, think Chrissy Teigen as of recently, big puffed up cheeks, or Kylie Jenner at the Met Gala where everybody was saying that she looked like she was 40 years old. Their faces basically look like they've been blown up by a balloon. That is pillow face. And that is all because the filler has not dissolved. And a lot of people assume that it was just because they got too much filler and it was like fresh and it hadn't settled.
The pillow face comment, in that a few celebrities are having pillow face because the fillers are not dissolving, is absolutely inaccurate, and it's misinformation and it's disingenuous. Pillow face doesn't come about because the filler doesn't dissolve. Pillow face comes about because of the round filler being used on the patient. Pillow face occurs when the product breaks apart. Remember the breakability. Breakability is when that product breaks apart and travels to other areas in the face. Pillow face occurs because of that. There are some fillers on the market that has a higher breakability. Other fillers have a very low breakability, so they stay in place. Those are the fillers I use mostly. Breakability tells us that products are going to break apart and go other areas and create full extended cheeks and faces. We saw that being prevalent in the early 20-teens. I think 2012, 13, we started seeing pillow giant faces. It's linked back to the type of filler being used. It's not just the filler. It's the practitioner not having the education, understanding, or training to use the right filler to prevent pillow face. Pillow face does not occur because the filler does not break down. It does break down. It doesn't occur, pillow face doesn't occur because the filler does not dissolve. It does dissolve. filler can last over 5 years. Yes, remnants of the filler can last. It doesn't mean it's inflating, but remnants of the fillers can last, which I believe is a great thing. Of course, if it's done well in the right place, I would love that filler to last 10 years because my patient is going to look great for 10 years. So the filler lasting so long is not a problem. It's a type of filler being placed that is the problem. So we're going to have many individuals opining on pillow face and fillers and it not dissolving, and the root of this concept is false. Pillow face occurs with the over-injecting of products and never because the filler stays. If a patient came to me and they had fillers 5 years in a row and they look great, but they need something on the temples or the nasolabials, of course I would inject. If a patient comes to me with overinflated fillers, why would I continue to inject? Now let's look at Madonna's face. We don't know what is in Madonna's face. It could be filler. It could also be fat grafting, taking fat from other parts of the body and injecting in the face. The number one cause of pillow face, I would argue, is fat being placed in the face. That can overextend the face, especially if you gain weight, because fat also expands when you gain weight. So what happens when you're 110 pounds and you put fat in the cheeks? Now you're 150 pounds. That is going to grow. So pillow face can occur from many different reasons. It's not because fillers last longer than 5 to 10 years. The filler may last 5 to 10 years, but the effects does not. Not because you have filler in the face mean that you have an outcome. You can have fillers in the face for 10 years and need fillers. So the remnants of the fillers that are lasting in the face is not really giving you a positive effect or any effect of the matter. So fillers lasting for a very long time is not the problem. Again, the problem is the injector, the experience, the knowledge, and the technique being used on the patient. Well, I'm going to stop this clip here. It's about 3/4 of the way because the more she speaks, she is kind of clickbaiting, if that's the right term, for more followers and viewers. And I think this becomes, it started out being generous in terms of creating a topic and a platform to talk about fillers and some of the misinformation, but then it just kind of became shaming and berating individuals who have done fillers because she herself is young and probably don't require fillers yet. At some point she might, she will. Many individuals denounce fillers when they're young. I've been doing this for about 20 years, and many individuals who denounced fillers in the early 2000s are now doing fillers today. So when we're young, our perspective changes as we age. And as we age, we come about other insecurities. So we can never remove our securities. We can change how we handle them. But when we're young, we see things different. When we're older, some things are necessary, sometimes just to keep our sanity or to keep us feeling good about ourselves. And why should you be shamed about that? I understand celebrities become punching bags, but why should a celebrity be shamed because they're attempting to look better? I think if a celebrity has a really poor outcome and it's from a trusted doctor in her neighborhood or her group, then she needs to find a different injector to make her natural again. And it is possible to dissolve fillers to create a more natural look. And the reason why the population started doing fillers was because there was nothing else. Creams didn't help, makeup helped on the surface only, but also contributed to cancer, bad skin, and other dermatologic issues. Face yoga, increased muscle activity creates lines. That's all I'm going to say about yoga and facial exercises. So nothing seems to work. The point being is, let's not bash each other over the head constantly over a device, a medicine, a drug. Let's look at the root of the problem. And the root of the problem with fillers is not that they last more than 5 or 10 years. It's negligible. The root of the problem with fillers is the person who's injecting this product is either underqualified, not a medical practitioner, does not have enough education or knowledge or know-how about the rheology or the science of the filler. And lastly, the injector is not choosing the right filler for the right patient. So the root of the problem goes right back to the injector again and again and again. The filler is a tool. Botox is a tool. We can't blame the hammer because the house turned out crooked, right? We can't tell, the carpenter can't tell you the hammer was bad and so the roof isn't done well. You cannot blame the tool. And in this case, we're blaming the tool. And it's not the tool, it's the injector. It's also not really the pharmaceutical company. They have their faults. But in regards to this, not quite. Again, it boils down to the injector choosing the wrong product or being swayed by some pharmaceutical companies to use their products in many different ways that they can be swayed in. And that's my soundbite for this clip. If there's any other clips you would like me to speak on or opine, I'll be happy to do so. Just subscribe and follow, or just place the comments in the comment section about what you would like me to discuss based upon my 20-year history and experience in aesthetic medicine, providing Botox and fillers to wonderful individuals, young, middle age, and older age.